Welcome to Thriving Thursday. This week, we're talking JP drains. So, if you've ever had any kind of major surgery, particularly in the breast cancer world when you have mastectomies, sometimes lobectomies, and also during reconstruction, these drains are a staple, right? They help in the healing process after surgery by removing fluid from inside the body and putting them into the drain. And one of the ways that your surgeon will measure how soon you can have the drains removed is by how much fluid you have in here. Over time, you should have less and less and less fluid, and your surgeon will tell you when you get to a point, usually around a week and a half, 2 weeks, when they can remove them. For some people, it's longer, and your body just needs that time to heal and get rid of the fluid. But oftentimes, when you go through a surgery, when you come home with these drains, you don't get a lot of training on exactly what you're supposed to do with them when you get home. So I want to use this handy example drain as a way to show you how you can manage them when you get home, and a really helpful technique to help really pull that fluid out. And so I just want to make sure you can see this is what the JP drain looks like. Usually this is, it'll come home and it'll be pinned on a surgical bra like that and just kind of dangling. So what's visible is the bulb and then the tube, and the tube connects to kind of like a wick, which is inserted inside your incision spot. One of the helpful little things real quick that we have here at Going Beyond the Pink is a little drain bag that you can pop the drain in, and it makes it so it's softer against your skin, or you can hide it if you don't want everybody seeing all that fluid, or you don't want to see that fluid. And you can pin this to your clothing so it dangles and you can have your hands free. You're not going to be walking around holding a drain all the time. Anyway, those are really great. We've got lots of them here, so if you're in need of some, please come by the office, set up an appointment, and we'll get you some of your drain bags. Another useful tool for dealing with drains, once you are cleared to take a shower, is a lanyard. We've got a bunch here if you want, but if you've got one at home, that's great too. So when you're getting ready to go in the shower, you just put this lanyard on, and you can connect your drain bulb by a safety pin right there to the lanyard. And you may have more than one drain. Most people come home anywhere from 2 to 4 drains. So you would connect them all right to the lanyard, and then they can dangle so you have your hands free to shower and nothing's pulling on your incision site. It's a really helpful tip, especially for that shower time, because you're not wearing any clothing for which you can pin this to. So get a lanyard from us or have a lanyard at home and pin away. Makes life so much easier. So in terms of draining, let's talk about that. When you come home with these, you are told you need to drain and that you need to measure, but oftentimes no one really shows you how to do the draining. So I wanted to take a moment and share a technique that my husband actually kind of perfected over all the times that I had these drains. And it really worked. And I will tell you from the patient's perspective, based on his method of doing this, I could really feel that fluid pulling into this. But any way that you do it, just making sure to be able to clear that drain and clear the line so it doesn't get clogged up with blood, and so that it can continue to work effectively is really important. So here are some of the things you might need to have around. Coconut oil, either just regular coconut oil or the fractionated kind. If you don't have coconut oil, really any oil will do, whatever you use to cook with or anything. You just need kind of an easy to get to lubricant to soften things so that the tool that I'm about to show you to use will slide along the tubing. We like coconut oil because I have a lot of it around my house. You can either use a pen like so or a spoon like so. The back of the spoon, if you're going to use a spoon, we tend to prefer that we use the pen. So I'll show you using a pen. You just take a tiny little bit of oil, just enough to kind of smooth it out, and rub the oil on the pen so it's slippery. I didn't think about that. I've got slippery hands now. Usually I had my husband helping me do this, but it is something you can do on your own. So it's time to drain. You've got a full bulb, so you'll just have to use your imagination, and there's a lot of fluid in there, and it's time to take it out. So you pop the little top, nice and simple. You're going to have a measuring cup that has little milliliter lines on it, so you know exactly how much fluid you have. So you're going to just pour all the fluid out, try to make sure you get as much as you can, and you're going to pop that little cup down. And now you've got this empty bulb, so we're just going to shut it for just a second here. And what you do with this tubing is you're going from the very top, and you'll want to have someone holding the tube where it inserts into your body. You'll want to hold that close to your body so it doesn't pull. That's really important. But what you do with the pen then is to push it onto the tubing and slide it down, squishing that tubing as you go to push any remnants. And the more you do it, the more flexible that tubing's going to become to this. You have this nice slippery little pen, and you just push anything that's stuck in that tube all the way down into the bulb, right? You want to get it all out for two reasons. One, you want to have accurate measurements of what's going into the cup, but also the stuff that gets stuck up in this tube and that up close to your body as well can cause the tube to get clogged up. And if the tube is clogged up, then it's not going to pull that fluid from your body and put it into the drain bulb. So we need to make sure that you're clearing that tube and clearing your bulb all the time to make sure that you're not going to have any blood clotting issues or issues with things getting jammed up and then not clearing. Because trust me, once you have these drains, you'll want to get them out as soon as you can. So having a good technique will really, really help get you there faster. The other thing that we swear by when we were doing this at home was when you're done emptying everything and you've done the draining of the tube, squeeze that bulb so it's concave. Can you see like that? Squeeze it flat, get all that air out, and then when it's done, tap that, and then it will stay that way until it starts to pull that fluid, and you can really start to feel that pulling sensation, which, sure, it's a little odd. It doesn't hurt a bit, but it pulls that fluid even stronger into it, so you're getting more of that fluid out. And that's just from our experience. Again, I'm not a doctor, but this is how we did it at home, and it was really useful. And I've shown this to my surgeons, and they all said that it's an appropriate way to do it. So I wanted to share that with you. This one is going to refill simply because I don't actually have the wick part in my body. It's just stuck back there in my pocket. But anyway, just a brief tutorial on how you can use your JP drain, make the most of it, get the best of it so you can get that fluid out and heal fast. I hope that you found this informative this week. Thanks for sticking with me, and happy Thriving Thursdays. See you next week.